Hello, my name is Deontae Johnson. I'm a third-year professional PharmD candidate at Florida A&M University, and I'm here today to present my Journal Club article. I wanted to talk about something that was common to the general public, so my discussion today is going to involve the sexually transmitted infection, human papillomavirus, commonly referred to as HPV. The title of my article is Immunogenicity and Safety of a 9-Valent HPV Vaccine. But before I talk about my article, I wanted to give a brief description of what HPV actually is. HPV is currently the most common sexually transmitted infection in the United States. It can present in signs and symptoms of genital warts. It can also go on to lead to several types of cancers in men and women, one being cervical cancer, cancer of the anus, and also cancer of the throat. The 9-valent HPV vaccine is currently marketed as Gardasil. Prior to this study, Gardasil was only indicated for the prevention of infections and diseases in the young female population of 16 to 26. So this brings me to the objective of my study. The objective of the study was to determine if administering the prophylactic vaccination 9-valent HPV vaccine to children, boys and girls, 9 to 15 years old would show equivalent treatment and efficacy observed in the 16 to 26 female population. I believe this was an excellent study. I believe it was fair and it was very diverse. This was a non-inferiority immunogenicity study. So let's begin. This study was conducted at 72 different sites involving 17 countries. The goal of this study was that it started off with 3,066 participants, and they were to receive a 3-dose regimen of 9-valent HPV vaccine administered at day 1, month 2, and month 6. Now, they would be tested at day 1 and month 7 to see if efficacy and treatment was observed in the boys and girls population of 9 to 15 years old. All right. The inclusion material of this study was that the cohorts, boys 9 to 15 years old and girls 9 to 15 years old, as well as young women 16 years old, had to be generally in good health and remain abstinent from sex at the start and throughout the study. The cohort of women 16 to 26 years old were required to be generally healthy and have no history of abnormal pap smear test results, and no more than 4 lifetime sexual partners, and no previous abnormal cervical biopsy results. Now, in this study, it was understood that the boys and girls in the 9 to 15 years old population weren't sexually active, so we really wanted to test the efficacy and treatment to see if the strains of the HPV vaccine would come up positive when tested. Exclusion reasons for this study included pregnancy, known allergy to any vaccine component, thrombocytopenia, immunosuppression, and previous immunosuppressive therapy, or previous receipt of an HPV vaccine. Exclusion criteria included incompletion of dose regimen, pregnancy, and one patient also died of sepsis secondary to a new diagnosis of acute myeloid leukemia. So after the inclusion and exclusion material, this brought us down to remaining of the 3 cohort groups. If there were 1,800 girls 9 to 15 years old, 600 boys 9 to 15 years old, and 400 women 16 to 26 years of age. I mentioned earlier that I found this study to be quite diverse. It wasn't limited to just 1 or 2 races. Races of participants included American Indian, Alaska Native, Asian, Black or African American, multiracial, Native Hawaiian or Pacific Islander, as well as white. Carrying on with this study, to be included in the non-inferiority immunogenicity study, participants had to meet 3 requirements. They had to be seronegative at day 1. They also had to receive all 3 doses of the correct clinical material within acceptable day ranges, and they had to undergo a post-3-dose serology result within acceptable day ranges. Each participant received a 0.5 milliliter injection of the 9-valent HPV vaccine. They were observed 30 minutes post injection to follow up for adverse events. There were only one discontinuation and 2 vaccine-related adverse drug events reported in this study. The most common injection site adverse events were pain, swelling, erythema, and pruritus. The most common vaccine-related systemic adverse event of young boys and girls included headache and fever. The incidence of injection site and vaccine-related AEs were noted to be lower in young girls and boys compared to young women. Now, this study was constructed on a 95% confidence interval. Already believed that efficacy and treatment observed in the boys and girls population of 9 to 15 years old would be similar to the already indicated prophylactic treatment observed in the young woman population of 16 to 26 years old of age. Noted with the primary endpoint that after the 7th month mark of the patients being tested, that they were believed that serum traces would be observed. Now, besides testing serum traces of the HPV vaccination, in this report we also evaluated whether the 9-valent HPV vaccine induces non-inferior serum antibody responses in boys and girls 9 to 15 years old. And so it brings us down to our results of this study. The seroconversion for all non-HPV vaccine types was achieved in 99% of participants in this study. The antibody responses in 9 to 15-year-old boys and girls were shown to be non-inferior to those observed in 16 to 26-year-old women. This brings me to our secondary endpoints. The serum samples were obtained at 24 and 36-month mark after this trial, so it was more after a follow-up. Remember that this trial was only supposed to be for a 7-month span. So at the 24th and 36th mark, positive traces of the 9-valent HPV vaccine were shown in 90% of the participants. So this brings me to the author's conclusion. The study concluded that the results validated that the 9-valent HPV vaccine can be beneficial in children ages 9 to 15 years old of age, allowing Gardasil 9 to be recommended in the adolescent population. This brings me to my conclusion. Now, I briefly mentioned that HPV is a commonly transmitted infection seen in both females and males. Before this study, there were currently 2 vaccinations, HPV-4, which is a quadrivalent, and HPV-2, which is a bivalent vaccine, and they were indicated for young women to reduce the risk of contracting HPV. In efforts for prophylaxis treatment, a newer vaccine, 9-valent HPV vaccine, which led to this study, is indicated to prevent HPV infection in young women 16 to 26 years of age. The 9-valent HPV vaccine was licensed in 2014 in the United States under the name Gardasil 9. This study has led to the approval of Gardasil 9 in the young male 9 to 15-year-old population. This new indication provided excellent clinical benefit in advancing the care of preventing contraction of HPV in an increasingly sexually active teenage population. It is rewarding to see the clinical advances made to protect our youth from sexually transmitted infections and even cancer, such as cervical cancer, throat cancer, and cancer of the anus. For my critique of this study, I found it to be a well-conducted, unbiased clinical trial presenting strong evidence to support the initial analysis of young children ages 9 to 15 benefiting from the 9-valent HPV vaccine. This study also showed that this vaccine was safe and well tolerable in these patients. The study included a diverse group of participants ranging from 72 sites in 17 countries from various races. It was effective to see a benefit in both young male and female participants. It was also IBR approved, which gave it some credibility. One weakness that I did notice, I would have liked to seen an additional cohort group involving young men ages 16 to 26, being that they are more sexually active. I feel like that cohort group could have gave this study more clinical evidence as well as credibility for the treatment of Gardasil 9 in young men who are more sexually active. But nevertheless, I thought that this was a safe and fair trial, and it led to the indication of Gardasil 9 for the use of prophylactic means of treatment in the young boys population. And this is a first for this study, or this type of study. This completes my journal article. Thank you for watching.